Most people who die do not need medical aid in dying to help them die. However, up to a quarter of people who die with chronic illness die with uncontrolled pain. Over 20% die with uncontrolled shortness of breath. I started to believe in medical aid in dying when I turned 40. My mother died after having been really sick with pancreatic cancer. The next year, my father-in-law died of an abdominal sarcoma. He went 3 years with multiple surgeries and treatment before he died. And after watching the two of them die, I said to myself, I'm a physician. There's no way that I want to go the way that they have died. My screening test was positive, and I came in and had a biopsy. And a week later, I got a call saying, you have prostate cancer. I then went through treatment after treatment after treatment. And the bottom line is that that it is incurable at this point in time. This is a social justice issue. The definition of justice is that two people who are facing a similar situation should be able to have a similar outcome. If I'm able to, die without suffering, other people should also be able to die without suffering. From my perspective, it's definitely the individual who should have autonomy here. It used to be the doctor, made all the decisions, patients had minimal input, and we've gone really far beyond that. Medical aid in dying is really taking us to a level where, we are asking the person who is going through end of life, when is the point that this is too much for you to bear? And we will give you the tools to help you so that you don't suffer. When people use medical aid in dying, they're making an autonomous decision to end their suffering based upon good mental decision-making process. They have thought about this usually for many months ahead of time. They've discussed it with their family. They have discussed it with several medical professionals, and they are making a rational, autonomous decision.